My name is Rhonda Arterberry, and I'm going to talk to you today about medication administration. So when you are getting ready to give a patient their medication, you're going to identify them by asking them their name and verifying their date of birth. If they are, and checking their armband. If they are nonverbal, then you have to check their armband. Medication administration is very, very critical. You have to make sure that you have the right patient, right route, right dose, right time, right medication, and of course, right documentation. Um, with those 6 rights, and I say 6 rights, some people say 5 rights, but I say six rights. With those 6 rights, that is going to be the key to make sure that you prevent medication errors. There are different ways and different medication routes that medications can be administered. There is PO medication by the mouth, subcutaneous through the fat, intradermal under the skin, IV, intravenous. Some patients that are not able to swallow, they have to take it by G-tube. There's also parectal and transdermal. Some medications just go on top of the skin, some are just topical agents. So with all of these things, and you have to consider when you're given these medications, is that you want to make sure that you verify a patient's allergies. If they have allergies to, say, for instance, penicillin, and like we're getting ready to become RNs, so we will be given Rocephin IV, but if they are allergic to penicillin, they cannot take Rocephin. They may have to have a different type of antibiotic. If you are giving PO medications, and it's you have to consider whether they're getting ready to drive a vehicle. I work in the emergency room, so a lot of patients come in, and they are coming in for pain, and sometimes the doctors will prescribe Norco or something PO that's a narcotic. And one of the things that you need to ask, if they're operating any heavy machinery. Sometimes we give a headache cocktail, which they prescribe Benadryl. And if the person is driving, you don't want to give the Benadryl. So there are different considerations that you need to key into when you're giving medication, because it can not just cause harm to the patient, but you let that patient go home, then you can, your license can be affected, and you don't want to do that. So like I said, we're going to remember your 6 routes. You're going to consider which route you're giving the medication, so that a lot of times doctors will change the order because, say for instance, if it's Toradol and you see 60 milligrams in the doctor ordered it IV, well, you're going to say, hold on, hold up. You're not going to give the Toradol 60 milligrams IV. You want to give 30 IV, and you want to give 60 IM if that's how they order it. So you got to kind of watch the way the doctors order the medications also. So again, like I said, the 6 routes, and you're going to remember, the 6 rights, and then you're going to remember the correct route, identifying the patient, make sure you have the correct patient, correct medication, the right time, the right dose. And then after you give it, then you want to evaluate to make sure that they don't have an adverse effect on the patient, not an adverse reaction, and that the medication is going to do its job, and that the medication was effective. Thank you for your time. This is Rhonda Arterberry. I'm rushing because I don't know if this is going to record, but anyway, thank you so much.